Could you give us a bit of background about rapid antigen testing, and particularly how it's different to the PCR test that we've all come to know and love?
Yeah. Okay, so the PCR test is very, very accurate and very, very sensitive. So it can detect very, very low levels of the virus. This means that you can test PCR positive before you're necessarily infectious, because it's getting really, really low levels of the virus. And then you can also test PCR positive once you're no longer infectious, but you've still got the, sort of residual bits of the virus residing in your nose, but you're no longer shedding enough to actually infect somebody else. So the PCR test will really pick up very, very low amounts of the virus. The rapid antigen test is firstly more rapid in its detection. You don't have to send it off and wait whatever the waiting time is in the place that you live, but it's less sensitive. Now, that's not necessarily a bad thing. What you need to see the rapid antigen test as a way of determining not if you're infected, but if you're infectious. So if you test negative with a rapid antigen test, that doesn't necessarily mean you don't have COVID, because you could be in the very, very early stages of the infection and it's just not sensitive enough to pick it up. But it probably means you're not likely to infect another individual. So this has been the benefit of rapid antigen testing, and Australia is actually very, very behind in this. This has been widely used in Asia and Europe and North America. What people can do is do a rapid antigen test, and then if they're negative, go to work, and then come home and they test again. And if they then test positive, probably they weren't likely to have infected anyone in that preceding day because they weren't infectious. They were infected, but not infectious. There are, of course, limitations with every test. So there will be false positives, false negatives. We know that. But I think you should see rapid antigen testing as a relatively easy way to determine if you're likely to infect somebody else.
Is it an alternative to a PCR test, or should it be something that we do alongside PCR testing? What do you sort of see as the settings where rapid antigen testing is it something we should be doing every day, or what are some of the settings that you see it's valuable for?
Yeah. So probably some of the settings where it's been used to the greatest value, certainly overseas, has been in school settings, where you really don't want to have to shut down schools and send kids home and isolate them every day, with an outbreak of COVID. So what's actually been shown is the most beneficial approach is if you give these kids a test every day, a rapid antigen test every day, then every day you're clearing as to whether that kid is infectious. They go to school, come home, test again the next day. And so theoretically, everyone is not infectious at the time they're at school. They may be infected, and the frequency at which you do this test with the rapid antigen test is one of the benefits, because obviously if you're trying to do that every day with a PCR, you would submit your PCR test, go to school, you'd probably wait at least 24 hours for the results if you're lucky, then you'd get that back. And again, remember the PCR is so sensitive that even if you're at the end of your infectious period and still got dregs of the virus there, it would detect it. So the benefit of the rapid antigen test is it really is a quick test to determine if you're about to go out, maybe visit family or visit an elderly relative, just to check that you're safe to do that. The PCR test is a really good test if you are then positive with the rapid antigen test. You can then go for a PCR test to confirm that value, and that's where I would recommend it. And then also if you're somebody who is maybe vulnerable to severe disease and you want to detect the infection as early as possible, so potentially you can start things like monoclonal antibodies, which we know if you start that treatment very, very early in the course of infection, you actually have better odds. So there's different uses for the different tests.
Do we know yet whether the rapid antigen tests that are around on the market will detect Omicron?
We don't, because there hasn't been enough data looking at it. Theoretically, from what I've seen, it should. Whether it detects it, my concern would not be whether it detects it or not. My concern would be, does it detect it at the same sensitivity? So do you need more virus present for it to be detected than, say, a previous variant? That's certainly something that's being investigated now, but I would be very, very surprised if it didn't detect it. It may just be that the sensitivity is a little bit different.